Hi, this is Dr. Homer Lim, and you're listening to your Holistic Health Podcast. Hello, good afternoon. Welcome again to our weekly talk here at Kesis Holistic Health. So this afternoon, we'll be talking about what we call, tawag natin, geriatric syndromes, no? Geriatric syndromes, meaning, it's a nice word to say na syndromes, no? Syndromes is yung group of symptoms, no? So when we say syndromes, it's a group of symptoms. So usually, when we say geriatric syndromes, kumbaga, what are the things that old people feel? So that's what we call geriatric syndrome. So it's just a nice way of saying how is it to feel old, no? So what do we mean by geriatric syndromes? Ano ba yung mga usually what old people feel or what old people suffer as they become older, di ba? No? So one of the most, how do you say, common, no? Which is number one is yun nga, yung joint pains, very common. Joint pain sa knees, no? Sa fingers, no? Usually, they would start having pains sa joints, no? Sa knees, sa hips, sa fingers, no? These are usually yun yung unang nararamdaman, and usually, older people do start feeling it, especially when they wake up, no? Magiging stiff, parang stiff, matigas, masakit, no? But when they move through, exercise, no? Nawawala yung pain tsaka yung stiffness. So, ang tawag dyan ay osteoarthritis. So, these are some of yung more common, yung joint pains, no? So, another syndrome that is very, very common among yung mga medyo may edad na, no, is, yun nga, yung hair, no? You start having, tawag nating white hair, no? Because of, yun nga, as we age, no? The ability of our hair follicles to produce melanin, nababawasan din. So, nagkakaroon tayo ng white hair, no? Incidentally, no, one of the things that they found out bakit magkakaroon ng ganun, no, why older people seems to have more white hair is because of the lack of glutathione. So, even sa hair follicles natin, no, it needs glutathione to maintain yung blackness or yung color ng hair, no? So aside from the joints, the hair, the eyes, no? Of course, as we become older, yung ability to see, especially yung mga malalapit, no? So, yung mga sabi nga nila, no? If you start having problems reading small print, no? That means that, you're aging. Meaning, yung eyes natin, yung ability of the eyes to adjust, no? Adjust yung eyes as we see or look or read small prints becomes more difficult kasi nga tumatanda, yung lens natin tumitigas, no? No, another problem as we become older, yung cataract, no? Ano ba usually nakikita ng mga may cataract? Malabo, parang lumalabo siya, parang cloud, no? May malabo. So that's yung tawag natin, nagkakaroon ng cataract, no? So luckily, no, or fortunately, yung cataract very easily madali nang gawin yan. You can just have it removed and replaced with a new lens, no? So, yan. So, another important thing that we have to understand also, especially with older people na may tawag nating vision problems, no? Yung mga nahihirapan na makakita sa lateral or yung sa kapiligiran. So, they can see straight, but yung sa side, no, parang nawawala yung tawag nating peripheral vision o yung sa side ng views nila, no, yung sa extreme left or extreme right, parang malabo na, no. So this is very important, no, kasi baka meron tayong tinatawag na macular degeneration. So it's very important for the elderly, no. So as you become older, you make sure na you have your eyes checked up. Kasi once you develop tawag nating macular degeneration, no, medyo hindi mahirap gamutin siya kasi nerve yun so mahirap gamutin. So you really have to make sure that you check your eyes, no, at least once a year, just to check for signs of macular degeneration, which is very, very hard to treat, no, or almost, there's no treatment really aside from making sure that it doesn't go degrade faster than normal, no? So, the eyes. Then next, the ears, of course. Diba? As we become older, yung mga matatanda, diba? You have to shout at them, sisigawan mo sila because they have a hard time hearing. Same thing, because of the nerves having problems, nasisira yung nerves. So, the ability to hear becomes less, no? Especially yung mga high-pitched sounds, they have a hard time listening to high-pitched sounds, no? So, that's one very common thing among elderly, no? Yung high-pitched sounds, sometimes hindi nila masyadong naiintindihan or naririnig, no? And then, of course, very common also yung sense of taste, no? Yung mga matatanda, di ba? Minsan, they will complain, ba't walang lasa to? And yet, parang meron naman. Or if sila ang nagluto, paglabas, parang either sobrang alat or sobrang tamis, is because their sense of taste becomes less. As they become older, no, your sense of taste can be reduced up to 60%. So, just imagine 60% of your taste receptors are affected to the point na yung kinakain nila minsan ko-complain sila walang lasa. So, they keep on adding either salt or soy sauce, no? So, you have to look into that. If you see your parents or your loved ones na medyo matanda na or your grandparents na mahilig na maglagay ng kung ano-ano, that's maybe because it's their sense of taste is already been affected, no? So, they have to have it checked, no? So, they have to be aware also na sobra dami na nilang asin na ilalagay or sodium into their diet, which is not very good. Okay? So, we have those senses, no? Your eyes, your nose. Nose, hindi masyado, no? A lot of people still retain a bit of their sense of smell. You have your ears, your taste, no? And your touch, no? Yung mga matatanda, no? Sometimes they complain ng, yung fingertips and their toes, parang walang namamanhid or nangangapal, no? So, this is a sign of nerve damage or deficiency of what we call vitamin B, no? Especially B12. So, kaya nga may matatanda, no? Once they feel na parang namamanhid or nangangapal ang mga fingers and toes, they go try to find a multivitamin B kasi alam nila with vitamin B, it can be reversed quite easily, no? So, these are things that, older people do have problems of, no? Now, what's important with mga symptoms of aging, no, that are not normal, meaning, kumbaga, feeling natin it's sign of old age, but it's actually isn't, no? Yung biglang pag-lose ng weight, no? Biglang pag-lose ng weight, that's not a sign of aging, okay? Normally, as we age, if you are eating the same amount of food as you were like 5 years, 10 years ago, and you are losing weight, no? Then, that is an issue. Kasi usually, as we age, our metabolism, no, yung metabolism ng tao becomes slower. So, they easily gain weight. So, but if you lose a bit of weight without actually dieting or you're not exercising, that could be an issue. Okay? So, you have to make sure if you start losing weight, you have to have it checked, no? Now, other things to consider when you are elderly is constipation. Very common yan, no? Constipation. So, a lot of women, no? Specifically women who are constipated. So, this, make sure na, if you're constipated, no? Despite drinking like 1 to 2 liters of water in a day and you're still constipated, no? Don't take too much fiber. Why? Because as we age nga, bumabagal yung movement ng intestine natin. So, once bumabagal ang movement ng intestine, then you're more prone to constipation, right? Because mabagal na yung kilos ng intestine. So, if you take fiber, mas titigas pa siya. So, this is a time wherein, ito yung time na that's where fiber doesn't really work for you, is when your bowels or yung bituka natin is mabagal na. Mabagal yung kilos, no? If you add fiber to your diet or you take extra fiber, then nagiging mas matigas. So, in elderly, I would suggest instead of taking fiber, they eat lots of okra, saluyot, papaya, no? Which is a lot of elder people are doing because they notice na mas parang mabagal yung bowel movement nila. So, rather than taking fiber, they take yung papaya, saluyot, okra, no? Aloe vera, also very good in making your stool soft para mas mabilis ilabas, no? And then, One more, very common yung mga matatanda, ihi ng ihi, no? Especially men at night when they keep on peeing, lumalabas, bumabangon sa bed 3 to 4 times a night, no? Just to go to pee. So that's a big issue. So that means that they might have some prostate problems, no? So some men, no? Some women, if they're very common yung ihi ng ihi din sa gabi, no? Of course, they don't have a prostate. That could be because of some urinary infection. Okay? So for men and women, elderly, no? If you keep on going to the toilet 3 to 4 times a night, hindi yun normal. That's not a sign of aging. That is something else that you have to address. Okay? So, something that you have to address, number 1, yun nga, sudden weight loss, ihi ng ihi, okay? Sudden loss of, parang madaling napapagod, biglang parang madaling napapagod, nagmamanas ang paa. So, these are things that we have to be careful and aware of. Pag bigla kang ganun, nagkakaroon ka ng pamamanas or bigla kang nanghihina, hindi ka makabangon, so you have to have this check kasi definitely that's not a sign of aging, no? So we really have to be aware and careful of this, no? So these are some of the things that yung tinatawag natin geriatric syndromes or signs of aging, which are common. But there are also signs na hindi talaga aging. It's more of other issues na more critical that you really have to have it checked as soon as possible. Especially now, because takot tayo because of the COVID. No, there you still have to make sure that you have to see your make a point to see your doctor, whether it's through through a phone call, through a teleconsult, no? At least kahit paano you are checked out, because right now in this time, because of this pandemic, hindi talaga magandang magkasakit na ma-hospital ka, right? Nobody wants to be in the hospital, especially now malapit na mag-Christmas. So make sure that if you have lingering symptoms or symptoms na pabalik-balik o hindi gumagaling, make sure to have it checked, because wag na natin hintayin na lumala, kasi hindi lang kayo ang maiistorbo, yung buong pamilya, kasi they will have to bring you to the hospital and all this. So mas malaki gagastusin natin. So as much as possible, if we are able to address the problem as early as possible, then there's no issue, there's no fear of you going to the hospital, no? So my advice to the elderly or to your loved ones who are more than 60, make sure that you at least have a full checkup ng blood, x-ray, ECG, just to see how you are doing, para hindi naman tayo magkagulatan one day, because we do see a lot of patients who have signs and symptoms that are quite alarming, no? Yet they let it be, hindi nila pinapansin, then later on grabe pala yung sakit, malala na pala. So, we have to make sure that, to have it checked, no? Especially matatanda, kasi nagtatago ng sakit, nagtatago ng nararamdaman, because they don't want to bother the family, no? So, but it's also very important for them to understand and realize na if they will hide these symptoms, it will become worse, and then mas maagrabyado pa lahat at the end of the day. Okay? Okay. Now I will read some questions from our listeners and answer them in this segment. Why are elderly makulit? Okay, very hard to answer that. Number 1, they're makulit because madaling makalimot, right? Or honestly, sometimes they do not understand what you're saying, so they keep on repeating the same question. So that's why they become a bit makulit, no? So again, there's a makulit na normal wherein they keep on repeating the question because they do not hear you. Meron ding they keep on repeating the question because they literally have what we call dementia, or yung tawag nating dementia, yung makalimot na, no? They start forgetting stuff. How do you know it's dementia versus normal nakakalimot? So when usually with people with dementia, no, they start losing, even cannot remember the names of their own children, okay, or their birthdays. So once they have that, that's not normal. That's literally dementia, no? So how do you check that? You just ask them, so when's your birthday? Who's your best friend? O sino yung mga anak mo? Or saan ka nag-high school, nag-elementary? So these are some questions that you can ask to check if they still they do remember, because once you lose your long-term memory, that's really a bad sign. Pero everybody can, let's say, ano kinain mo kanina umaga? Half of the people won't have to try to remember what they ate, or what did you eat last night? Half of you will probably say, wait, let me think about it. So these are all normal, short terms. Usually you forget. Pero long-term memories, you start forgetting it. That's a big problem. That means that they might have some form of dementia. Okay? How to be forever young. No, not like me. If you want to be young forever, inject kayo ng formalin. No? Then you will be young forever, right? wala namang wala namang tawag dito. Wala namang forever na pill, di ba? Sabi nga nila, walang forever. Okay? So, okay. So some people, that's true, no? In a lot of elderly, especially as they go from 70, 80, 90, no? They start having a hard time eating. Meaning hard time, parang walang gana kumain. So, we have to understand, number one, yun nga, so less yung sense of taste nawawala. So, pag hindi masarap pagkain, natural, hindi sila kakain. Number two, ngipin. Baka wala na silang ngipin, or pangit na yung dentures nila, hindi masarap kumain dahil yung dentures nila gumagalaw-galaw. So, it's hard for them to chew. So, these are things that you have to consider. Also, of course, talagang ganun, habang as we age, no, people start eating less and less. That becomes a problem, no? So that needs to be managed, no? Next topic would be how to take care of elderly with dementia. Okay, that's a very technical topic, a very long topic. It's not for everyone, no? So, medyo depressing talaga, taking care of elderly with dementia, no? How to prevent white hair. Okay, how do you prevent white hair? Don't talk to your in-laws for at least 3 months. Siguro, mababawasan ang white hair. Honestly, white hair, if you take lots of, I would say, one supplement for white hair is glutathione. Glutathione can help, as well as biotin, no? But in general, white hair is also a sign of if yung severe stress can cause a bit of white hair. So, I would say a bit of glutathione. Kung I'm glutathione, acetylcysteine. Okay? That should help prevent white hair, aside from not talking to your in-laws for like 3 to 6 months. Okay. Thank you for listening to your Holistic Health Podcast. This is Dr. Homer Lim. Now, if you do have questions about your health, or you would like to request topics for our next podcast, please do message us at our FB page or Instagram at Akesis Holistic Health, or you may visit our website at www.akesisholistic.com. Thank you again, and please do come back for our next episodes.